Hi, this is Maggie, your physio, and I'm here today. Well, it looks like I'm ready for sleep time, right? But no, actually, I'm trying to set this up so that you can really understand what we want to do here. It's very easy for us to lie down and just go flat on our back, flat on our side, flat on the stomach, right? But really, our spine has some certain curves, and we also have different densities in our bodies. So I wanted to show you some of the positions are really ideal for going to sleep. Those are positions that in theory should help you to decompress your spine and allow the spine to be in a more neutral position. So I had to kind of play around with a few pillows because obviously on the ground it's a lot harder than on my bed. So you always take that into consideration, the density of your mattress. So the firmer mattresses obviously will require a few more pillows maybe to accommodate your body shape. Softer mattresses tend to sink a little bit more, so you might have the pillows in a different way so that things get a little bit more supportive. So I'm using obviously the floor as an example, and I'm using a pillow that's a contour pillow. So I usually find it helps really a lot to support my neck because I do not tend to sleep with my hand here. I have suggested to some people to sleep with a roll towel inside the pillowcase at the base of the pillowcase in case you have just a regular foam pillow. And it works really well, especially right after a car accident where your neck gets really stiff and sore and you can't seem to find a comfortable position, or if you had a rough day at the gym or did some sports or overdid some sports, and so your neck is really tight and stiff. So you really want to accommodate your neck so it properly fits. So best way is actually having a partner check to see, because you won't be able to see yourself lying in bed unless you take a picture or videotape yourself, which is an option. But you want to try to look at some points. So if I'm lying down, side lying and back lying are usually the best positions because really, stomach, you have to really twist your head. You have to twist your neck so you can breathe. And you have to lift one knee as well. So you're twisting your pelvis as well. So it's not really an ideal position to sleep in. So I'm going to show you the side sleeping position. And I had to really build it up with two pillows here to get that position that really aligns my neck. Okay, so I'm finding that that part that's a little deeper really accommodates the shape of my head. And that rounder, thicker part is the one that goes on my neck, but I have a long neck. So people that have a shorter neck or have a little bit more mass there, it might not feel comfortable. So really you have to shop around to find what works for you, okay? And if I'm seeing, I already put that pillow as habit between my knees, but if you look at my body, I'm trying to use clothes that are a little bit darker so you can actually see my body just sinks. So it really caves in here, goes up there and drops again, right? So my spine is really looking like an S shape here. My neck is nice and aligned, right? But down here, it feels like I'm really pushing down. That really closes everything on this side. So if you have back pain on this side, it really does not feel good. So I have to use another pillow underneath my waist to help align a little bit more that side. Okay, so it's looking a little bit better, but I still notice that my legs are pulling my body that way too. So that's why I got the other pillow to use between my knees. And that way it looks like now my line of the body is sort of a little bit more aligned, right? It might not be perfect, but I'm feeling comfortable. I feel like there's no pressure in any points other than the hard floor pressing on my shoulder and on my hip. But on a real mattress, that wouldn't be the case. So you want to really feel you comfortable, but also supported. Obviously, we toss and turn during the night, so you might wake up without any pillow, but that's not the point. You probably will sleep for most part of your night in that comfortable position, especially if you try getting into the habit of going to sleep in that position. Now, some people cannot sleep on their sides for several health issues or reasons, or they just prefer to sleep on their backs. So what we're going to do is when we sleep on our back, we will take off a little bit of that volume because now I don't have that big gap to fill. and the space between my neck and my head and my neck and my back is not as big as my side, okay? So I dropped to just one pillow. And so if I were to sleep on my back and I had my legs straight, I don't know if you can see, but there's a big gap here from the floor, between the floor and my back, if I have my legs straight. So my back does not feel comfortable with that. So I tell people to add quite a few pillows underneath their knees, not just one, but quite a few, so that the legs are a little bit more elevated. And it will feel a world of a difference on your back. Okay, so I feel like now I have a little bit more room to spread my back on, and it's supported. You might even add an extra towel, roll towel, or a smaller, softer pillow on this part. Or if you can, lift the legs even higher. Some people have support bolsters that they put underneath the knees to sleep in that position. Again, the tossing and turning will be a problem in the middle of the night, but at least you can try to fall asleep for the first part of the night with a little bit more comfort. I hope this helps. Night, night, everybody. Have a good sleep.